us begin today's session with the first speaker for today, Dr. Shri Raghunath. It's an absolute honor to introduce him. Dr. Shri Raghunath, an eminent physiotherapy professional and academician. Sir will be presenting on recent advances in physiotherapy. We are privileged to welcome you, Shri Raghunath sir, as speaker for today's symposia. Over to you, sir.
Thank you, madam, for the warm welcome. Today's topic of discussion is going to be on integrative neurorehabilitation, recent advances, specifically emphasizing on physiotherapy practice. See, as we all know, integrative neurorehabilitation is a comprehensive approach for various neurological disorders where that combines the conventional medical and therapeutic practices with multidisciplinary treatment options. See, this is what we look at as an integrative part in the neurorehabilitation, where we should emphasize on the holistic model, emphasizing on the individualized care, neuroplasticity, and specifically looking into the biopsychosocial aspects of recovery so that the individual will be better with the functional, fullest functional life and improve the quality of life. Next slide. Now, why this neurorehabilitation, that is integrative prospect? Very common neurological disorders we witness in our day-to-day life. One is the stroke, spinal cord injuries, Parkinson's disease, traumatic brain injuries, involve multi-complex system impairments far beyond, which actually affects motor, sensory, cognitive, and psychological domains, which will hamper the patient's full functional recovery and the quality of life. Next. Now, when we look at the traditional versus integrative approaches in neurorehabilitation, traditionally we have been treating the neurological impairments specifically on the clinical features. The clinical features generally constitute muscle weakness, balance issues, and spasticity. During the traditional approaches, we look at the goal to restore normal bodily functions through the repetitive exercises or therapist-led exercises basically, which can be in the form of strengthening exercises or range of motion exercises. These things, the improvements are isolated, may not always translate to the full functional recovery. This is what we have seen with the traditional approach. Whereas in the integrative approach, which is actually functionally oriented and rehabilitated, the real world participation and function will happen with the integrative form of treatment. This will definitely promote the meaningful recovery, and this can happen only with the multidisciplinary approach and a holistic approach. It can be in the form of physiotherapy, occupational therapy, speech therapy, psychology, yoga, mindfulness, music therapy, dance therapy, anything which will have a multidisciplinary approach and a holistic approach. This particular now we may be wondering that, why is this course shift? Always we ask ourselves that, when we are treating the patient, how can we fix the impairment? Rather, in the integrative perspective, we can ask, how can we help this person to live well despite the impairment? That is what we have to look at with the integrative rehabilitation. Now, all the basis of neurological rehabilitation is based on neuroplasticity. As we all know, the neuroplasticity is the change in activity in response to the stimuli. Now, the stimuli which we give can be intrinsic or extrinsic in nature, which can lead to beneficial, neutral, or negative impact with the stimuli. Beneficial is there could be a restoration after the functional injury. Neurological, previous slide please, yeah. Neutral, there can be no change, and negative, there can have a psychological, there could be a pathological consequences because of the negative effects of the neuroplasticity of the intrinsic and extrinsic stimuli. Next. Now, there are four important stages which happens with neuroplasticity, that is reorganization, axonal sprouting, synaptic plasticity, and functional reorganization. See, when we say reorganization, new connections is expected to form, and there will be a rerouting of pathways. Axonal sprouting will occur. There will be a sprouting of new connections. Synaptic plasticity help to strengthen the weakened synaptic connection, and functional reorganization helps to improve the better functions and the quality of life. This is what the basis of our neuroplasticity is all about. After the injury, the brain prepares to reorganize, sprout, and reorganize. The functional reorganization occurs after the injury because of the neuroplasticity. Next slide. Now, when we look at the neuroplasticity, there are two important things we have to look into. That is the role of motor relearning or learning and task-specific training. When we say motor learning, this emphasizes on the new motor skills what the patient has to learn post injury or the disease. This is based on practice and experience. Now, when we say practice and experience, is all about relearn and adapt to the movement that have been impaired. In motor learning, there are a few components which are very important in the patient betterment. That is specificity of practice, repetition, context-specific training, feedback, motivation, and goal-directed practice forms the components of the motor learning. Next is task-specific training, involves the practicing of functional task, which the patient have to actively practice the specific movements, which is emphasizing on a repetitive, goal-directed practice, which will help to improve the motor skills and promote neuroplasticity. Next slide. Now, when we speak about integrative neurorehabilitation technique, physiotherapy and movement-based interventions. Now, when we say movement-based interventions, in the integrative neurorehabilitation, there is fundamentally movement-based interventions, then modalities-based interventions, and therapy-based interventions. Now, first and foremost, movement-based interventions is, there are 5 recent advances which we have come across is CIMT, that is constraint-induced movement therapy, robotic-assisted therapy, virtual reality, hippotherapy, and yoga. These are the movement-based integrated neurorehabilitation which is used in the rehabilitation of the patients. First is the constraint-induced movement therapy, commonly called as CIMT. Now, this CIMT is a technique where we as professionals, we force the patients to use the non-affected extremity rigorously and make sure that the non-affected extremity is bound or not to use that particular thing. This is very commonly used in stroke, CP, TBI, and other central nervous system conditions. Next slide. The principles here are two important things. One is the learned non-use and forced use. Now, what is learned non-use? Learned non-use is something, this underlines the concept of CIMT basically. That is, we ask the patient the patient tries to use the unaffected limb predominantly to compensate for the loss of the affected limb. So we have to make sure that the patient doesn't compensate for the loss of the affected limb, and that is what we have to tell the patient. And forced use. Now, what is forced use is make sure that the limb which is affected, that is a heavy paratic upper extremity, to be used throughout his daily activities. You can protect that with the affected limb. Unaffected limb can be protected with a sling or wearing a mitt in waking hours, and make sure that the affected limb is used as much as possible. Next slide, please. Virtual reality. This is a beautiful advancement in the neurorehabilitation. This is basically a computer-based interactive multi-stimulation environment which occurs real time. Next slide, please. Now, the principles of this is to gain motor relearning happens in this, and with the motor functions improvement benefits increased motivation, customized rehabilitation, and enhance neuroplasticity. And the following are the populations which are benefited with this virtual reality. Now, robotic assisted therapy, this is even a better advancement in the neurorehabilitation, where robotic devices are used to assist the patient in repetitive and precise movement. This is the unique feature of this particular therapy, which can be integrated with the neurorehabilitation. Next slide, please. Now, the benefits of this is constant movement practice. As I said, it is going to be very precise. You can make sure that the precious data of this rehabilitation can be monitored, noted, aiding to the therapy adjustments, and also, most importantly, this enhances the safety of the patient when you are treating the patient with the neurorehabilitation. Next slide. This is one of the therapy part. As I said, it is a therapy-based intervention is used to monitor the physical, emotional, and cognitive challenges in the patient who have the vestibular issues to improve motor and sensory skills. Next slide, please. So this is the picture of the hippotherapy apparatus. Next. Yoga, we have been speaking about this since morning, and this has been tried, tested, an ancient system of physical, mental, and spiritual practices, the union of body, mind, soul, and universal consciousness. We all know the benefits of yoga, various techniques of yoga, postures, relaxation, chanting, meditation will definitely help in improving flexibility, balance, stress relief, improve quality of life, cardiovascular functioning, and postural awareness and body awareness. Functional electrical stimulation, this is the technique where this is a modality based basically where you apply low level of electrical current to specific muscles aiding in the functional movement. Next. There is a limitation with this. The patient with intact peripheral innervations only can be using this functional electrical stimulation because patient should be able to appreciate this. There are few neuromodulation techniques which are used in the recent past. That is the transcranial magnetic stimulation, which is where you stimulate the nerve cells with the electromagnetic induction is used as a technique. This is the picture of the electromagnetic induction where Faraday's laws of electromagnetic induction is used to stimulate the brain cells. Next slide. Next is transcranial direct current stimulation. Here we use the low level electric current to modulate the neuronal excitability. These are the few conditions where the betterment is seen, and these are indicated in these conditions. Next. Mirror therapy. Again, this is the therapy which is actually designed by an Indian called Mr. Srinivasan. It is seen that the reflective illusion of the limb, in order to trick the brain, the positive creative visual stimulus is given as a feedback to the brain, and the brain picks up the visual feedback than the psychosomatic. Next slide. So this is the way the mirror therapy is performed, and the benefited population are phantom limb pain, stroke, and CRPS1 are the commonest condition. Next slide. Motor imagery. Motor imagery is creation or recreation of motor imagery, which is actually the mental representation of movement without any body movement, where it is a self-generated sensory and perceptual process which we are going to use. In this, there are two types. Next slide. That is the visual imagery and kinesthetic imagery. Visual imagery is visualizing himself or herself when any other patient in the department is performing a particular activity. Kinesthetic imagery is feeling of that particular activity the patient will not be doing, but then that will in turn stimulate the brain cells that that is not functional. Next slide. Next slide. Dual task training is one more activity based. Here in dual task training, there will be a combination of two motor tasks, or one motor task and one cognitive task, where the patient is trained as a part of the therapy to perform this particular dual tasking, which helps in motor learning. Next slide. So here, the very common condition is Parkinson's disease, stroke, age-related decline, which helps in functional mobility, balance, control, and cognitive function. This will increase the brain activity. Next. Yeah, lastly, thanks. Basically, what I would want to conclude with this is a previous slide, please. Multidisciplinary approach, the integrative neuro-rehabilitation, where physiotherapists focus on the movement, occupational therapist focuses on daily tasks, speech therapist on communication and swallowing, neuropsychologist assess on cognitive function, social workers address on the psychosocial need, and all should work together for maximizing the benefits and collaborating to maximum the patient outcomes and improve the quality of life. Thank you.
Thank you for that insightful presentation, sir. I think your contribution has truly set a tone for our symposium. Now, moving ahead, I would like to invite our next speaker, Dr. Ashwini Godbole. Dr. Ashwini Godbole is an Ayurveda biologist with an educational background in modern biology. Today, ma'am will be presenting on a very unique topic with named as Ayurveda Neurobiology, Dialogue Between Shastra, Research, Clinics, and Communications. Over to you, ma'am.
Namaste, everybody. So thanks to organizers for this opportunity and all my colleagues on the dais. Thanks for this opportunity. So, uh, it's a big thing to talk about Ayurveda because I am not an Ayurveda doctor. I am a biologist by training, and trying to do research in Ayurveda has given me a lot of insights into how something can work very differently, and we can read it very differently. That's why this topic. And so Ayurveda, when coming to the word Ayurveda itself, it's science of life, Ayurveda, and that's what I have started. That's what has attracted me towards it, and I've been following that passion now. And this, it is apt for this summit because it is Global Wellbeing Conclave. So that's why I thought I'll talk more about wellness and little less about illnesses. We should talk more about wellness. So Ayurveda has a lot of insights into how one can live a healthy life, not only prevention of the diseases, but actually live more positive life, improve quality of life every day. So it is with mindful eating, mindful lifestyle, and some supplements or something to support the seasonal change, some small changes in your health. Next slide, please. So it is healthy food, the some nutraceutical herbs, and actually the medicinal herbs. Next slide, please. So the hypothesis, when a biologist like me looks at Ayurveda, I can easily see that biologists say while we are aging, or if some health is going haywire, there are changes at the molecular level, changes at the cellular level, and changes at the system level. So we can actually stop changes like bad protein getting accumulated like in Alzheimer's, Parkinson's, or normal aging. That can be taken care by herbs and spices which we have. This is a very broad hypothesis, and we can keep our energy regulation up like we do for with exercise. We can also do it with vegetables and fruits, and to make our body more resilient, body and mind more resilient, we can have foods like ghee, milk, and things which are normally fat based food, and we can adapt our body. So if there is any problem coming up or any stress coming up, we can deal with it without any much damage. So next slide. And that's why we take concepts from Ayurveda, like there are concepts like pragya, that is cognition, and there are practices which are linked to those concepts that we take from Ayurveda. We go to the modern science, we take clinical research methodologies and the experimental research methodologies from modern science, and do a transdisciplinary methodology to understand certain things. I'll show you that in a while. Yeah. So the first example is wellness. As I said, I'll talk more about wellness and integrative wellness research which is community-based research. And this is not clinic-based research. If person is not feeling any illness, then that's when we need to work on developing positive health, and that's what we have done. We have approached the community, all the 25 to 85 years, and try to see if Brahmi, especially Brahmi Grita, can mitigate the age-related movement cognitive decline. So as you can see on your left-hand side, we have used 4 formulation, and it's done. Why do we say it has to be done scientifically? Because we say Brahmi Grita is ghee plus Brahmi. So we have kept one group which is plain ghee, one group which is only Brahmi, and one group nothing, and one group with complete formulation. And we have used all modern technology which you can see, and the traditional Ayurvedic knowledge about Agni and Prakriti, and modern technology including MRI and functional MRI, and we have got the results which are in the next slide. You can see that Brahmi extract and Brahmi Gruta both work. But Brahmi extract works in younger population. In fact, it works very well on sleep, which is majorly a problem of younger population. Old population is happy and they can sleep very well. We have our mobiles and next day's presentation, like today I'm presenting. So that will be running on our mind, and then that makes the sleep a problem. But Brahmi Grita, on the other hand, takes care of all the degenerative changes which happen at the later end. And you can see rightmost column in the table, and you see that Brahmi Grita works very well on the age-relative changes. Next. We see it getting reflected also in MRI. So there are certain chemicals in our brain which change with age. And we see that, for example, choline and myoinositol, and we see the choline levels are brought back to lower level. The choline levels increase with age, and that is indication that there is some changes, not so nice changes happening in our brain. and that is actually reduced with Brahmi Gruta and not so much with Brahmi extract. So these are the indications that this formulation, which is a very nicely designed formulation, I feel, which has Brahmi juice of Bacopa monnieri with base as ghee, which takes care of degeneration. Brahmi takes care of any neuronal damage. So both together work wonders is what we have been seeing. And the same is reflected, next slide please. Yeah, and that I should mention that anytime I say tuppa, ghee, you will say, no, I have cholesterol problem, I have this problem, I have that, I cannot eat ghee. But that's not true. After 3 months of ghee intake, it does not change your lipid profile. In fact, it works makes it little better, but not bad. So we have to understand that it's not so straightforward that you eat fat and you get cholesterol. It's not like that. The body does a lot of other things on that. So the formulation design is such that Brahmi is bitter, ghee is supporting, and both together will not lead to any ill effects but good effects. And same thing we see in the experimental models where we use a tiny little nematode as experimental model. Why that? Because Ayurveda says Brahmi is not only Medhya, that is nootropic, but it is also Rasayana, it is Vyavasthapana, means it increases lifespan and health span. So that we checked in that nematode, which is called as C. elegans, Caenorhabditis elegans, and you can see the blue line is normal food and the red line is Brahmi food. And the lifespan of the worm is increased by 1.5 times. So it lives almost 30 to 50 times more. So percentage more lifespan. So that's the trick. And ghee, normal ghee also does the trick halfway through. So it is good to include ghee in your life, in your food, day-to-day lifestyle, but you need to remember how it should be eaten. So that is what it is. And then so even after we say all the wellness and everything, sometimes disease will happen, many times it happens. So we have to say that health and disease are in continuum. So Ayurveda always tries to set back everything to healthy condition, not just plugging the bottle, plugging the leak, saying that this is happening, so I'll plug that. But then there will be back pressure and then there can be some other problem. So it works at the bringing back to health. So next. So we always use the same approach that we look at the concept and practice of Ayurveda, we do the practice and we do the research. Next. Here is the one example of Parkinson's disease. So all of you must be knowing, might have heard of Parkinson's disease, where there is tremor, where there is stiffness, and you can see that was the condition before. And after the treatment, Ayurveda way, which says like Panchakarma, Shodhanas, Chamana, and Rasayana. See, this is the difference. The person was not able to get up and walk, and tremors, this is the difference, yes. So this is next slide. Thank you. So we are collecting data over number of people because somebody's severity might be there, somebody might have tremor, somebody might have more stiffness. So we are doing all that and we are taking help from people like Dr. Anuradha, where we know how to document it, how to look at it from the modern medicine perspective also. So then next. So that same thing, we also again can do it in the lab. And we can look at the neurodegeneration and the movement. Like we have movement problem, human beings who have Parkinson's have movement problem and neurodegeneration. Some neurons in the brain die. So both the things we can mimic in the lab. Next slide please. So normally the nematodes which I am talking move like this. Left video please. Yeah. And if they get Parkinson's, next, see their movement is affected. Now we can utilize this system and go deeper into the thing, because with human beings we have limitations how deep we can go at the genetic level, at the cellular level. So we use this. Next slide. Next slide please. Yeah. So the degeneration also we can check in the nematode. They also have dopaminergic neurons which are responsible for Parkinson's, and you can see that Brahmi and something else called Kapikachu, from which levodopa is isolated, the medicine for Parkinson's. We can see that both are reducing the degeneration of neurons as well in the Parkinson's model. Next slide please. Similarly, we have models for Huntington disease, we have models for Alzheimer's disease, and we can look at the cellular and molecular aspects of all these problems and health and aging and so on. So And so the one other thing which we can do, because it's a neurohab center and the topic, and sir has already described very well, I'll just say that we also work on pro-stroke rehabilitation. Next, please. So, to summarize the talk, summarize what I am trying to tell you, we feel that there are positive outcomes of transdisciplinary methodology. Let's join hands and work. And then Medharasayana, which are also foods. It's not only medicine. We always think everything is medicine, medicine. It's not like that. If you include certain food in the foods in your day-to-day life, you will be better off. And outcome of such integrative research will be, we should work together. Next slide, please. And come up with a protocol, with a solution which we can offer to the society. We need to forget our differences, like everything is working for the people. So we should, if we come together, we can find one piece of this jigsaw puzzle, and together we can complete this puzzle. So thank you, and I should thank my funders and the supporters and our team. Next slide. So team is big. You can see it's a very transdisciplinary team. People from Ayurveda, Ayurveda experts, then MRI. Sir is already sir is here. He is a physicist helping us with MRI, and the worm team is also here, worm and the fly and everything. Thank you so much.